Okay, well, good morning. Thank you for having us. We appreciate being invited over today. My name is Brenda, and basically I've been in this business for about 17 years, and I've lived in Charlotte County since 1973. Seen a lot of changes, big changes, and prior to that I spent 16 years as a vice president of a very large commercial bank. So I decided to make a career change, and I love it. I love it. I'm having a great time. And then I have with me Rebekah Goerl. Rebekah actually is, you'll see her smiling face. You go into the office, she'll be there. She has been in the business, got her license. 2 years now, got her license. She also graduated in 2015 with her 25. Thank you. Just keep correcting me, okay? In 25, she got her high school diploma along with her AA degree. And she immediately started to decide that she wants to get into this business.
I got my license before I graduated high school.
Yes. So we were, so yes, so that's really amazing. And then I'm going to tell you a little secret, okay? The owners, which Stephanie and Brian Goerl, Stephanie is my daughter, and then this is my granddaughter. So we are kind of a family business going on here. So anyway, so first thing we're going to talk about is our goals, really what we want to cover today is, and I'm not going to sit here and read everything to you, but what is Medicare, what does it cover, what it doesn't cover, and I talk loud and I also talk fast. So I had the nickname Roadrunner many times for high school because of the fact I talk so quick, so if I need to slow down, I'm going to ask you to please tell me to slow down. Basically, Medicare. Medicare is, oh, one other thing I want to mention. We are in an environment that's considered an educational seminar, and Medicare has some very, very strict rules that we cannot talk product specific. So if somebody asks me a question regarding their plan, I can't do that. Medicare will slap me really hard on the hand, but afterwards we could talk one-on-one, okay? Received any Medicare mail? If it looks real, chances are it's not. Okay, especially if you're turning 65, you're going to get all kinds of stuff, okay? And unless it has this logo that says CMS in the corner, it is an advertisement, it's through a marketing company, and as soon as you fill out one of those little cards or fill something out or call a phone number, you're going to get hounded. So, yeah, I've had people actually disconnect their phones. I mean, it's been crazy. So if it's got to have that CMS logo. Receive Medicare will never call you. Okay? They don't call. They do everything just like the IRS. They do everything by mail. So you'll never get a phone call from Medicare. It can be confusing, but we're going to try to clarify it. Be careful who you talk to. Okay? When somebody is turning 65, and usually it runs from the time of 64, 65, and 66, they get a list of people and phone numbers. And they'll come knocking on your door. They'll come calling you. So, and those lists are given out by Social Security. It's somehow they get it through Social Security. Still have not figured out myself how they do that, but they get it.
It's very expensive.
Very expensive, and they are going to just totally hound you. So, original Medicare. When you go ahead and you can get your Medicare, when you turn 65, okay? When you're coming into disability, so if you do apply for disability, it's a 2-year wait period before your Medicare is going to kick in. A lot of people get confused on that. They get their disability, they immediately think their Medicare is going to start working. It is not. It's a 2-year wait. Coming off of group coverage, okay, so a lot of people continue to work. You know, we work now, we don't get really retire always at 65, so if you're coming off of a group, you have an event that you can go into it, and then if, unfortunately, if end-stage renal disease is a big issue. When you go to enroll into Medicare, there's a couple of ways of doing it. Okay, number one is to call Medicare directly, or the Social Security number. Now, this has fluctuated a lot over the years because a lot of people go online, a lot of people call. My personal suggestion to you, and this is just me, okay, there's a local office here in Charlotte County. I've got the phone number that goes right into that office, and you can call and you can just say, I'm turning 65, and what they do is they do a phone appointment with you. So you don't even have to go anywhere. You just have, they set up a time, it takes 10 minutes, got to have your income information, because they're going to want to see where you fall as far as other things, and we've talked about that earlier. So it's important, though, that you call and talk to somebody right over the phone. I'm a firm believer of that. I have a lot of people do it online, on the computer. It does not. Sometimes it just can take months to happen. So, and don't wait a long time, okay? If you are turning 65 and you are not taking your Social Security, you need to start that process 2 to 3 months prior to turning 65. Okay? If you're taking your Social Security, you don't have to worry about it because the government's assuming that you are not working, and that they're going to automatically sign you up. Enrolling in Medicare. Again, we talked about it. This is some of this stuff we're going over. It's a little bit, probably twice here. But you automatically enrolled again if you're on Social Security. If you're not on Social Security, this is a big thing for people. They're going to bill you quarterly. And a lot of people are not prepared for that. So you need to be prepared that they're going to want that payment. And that payment is going to be, this year it's $202.90 or $203.90.
202.90.
I can see, I did this every time. I get that $1 off, and I don't know why I do this. It's $202.90, so that means you're putting out immediately $600, and you're going to be putting that $600 out. So, and sometimes it's not a problem, but just heads up, I get a lot of calls. People will say to me, I got this bill, they want all my 3 months. Yeah, they do. So, okay, when you are initial enrollment period, so if you are turning 65, this is why I said the 3 months. You got 3 months before, the month of, and then the month after. So you have a 7-month time period. They're very generous on this, the government, as far as that's concerned, because of the fact they give you that time period. But I actually have people call me 5 months after and say, I missed it. And then we'll talk about what happens then. So, when does my Medicare begin? Okay, if your birthday is between the 2nd and the 31st, it's always going to kick in the first of the month. If you are one of those people that have a birthday that's on the 1st, you get a little bit of an extra month. It comes up 1 month earlier for you. So especially folks that really are waiting, I always tell this joke. I used to have people when I started this business and they would say, I'm turning 65, I gotta go on Medicare. Now they go, yes, I'm gonna be on Medicare because they want it. It's so much better than their group plan, and it's so much more, better coverage. I gotta use the word better, but it's in some cases economically and as far as the coverage is concerned. Again, if you are in a retirement, you do not have to go on, if you're retirement or group plan, you do not have to worry about the 65, just as long as that group plan is going to keep you, okay? Sometimes employers will say, nope, you're turning 65, you need to go on Medicare. We're not going to cover you any longer.
Penalty.
And then there is a penalty, yes, if you don't, thank you. If a penalty is permanent, so basically if you do not take your Part B and you don't have what they call credible coverage, okay, then you're going to get a penalty that's going to follow you for your entire life. And you don't want that. You don't want that. Okay, now, a lot of times this comes up, okay, things to consider, group plan versus Medicare. I have sat down with countless people that are on a group plan. And even though I am an insurance broker, okay, I look at them and say, you need to stay on your group plan. It's better. You're going to have better coverage. It's not going to cost you as much as going on Medicare. So I've told most of them, keep it. That's where we come in a lot of times. If you're on a group plan, and you just want to review, we don't charge anything. We'll be glad to just look at it and say, this is your better situation, and you need to stay on that group. A lot of times, though, we have spouses that are different in ages, okay? So if you have a spouse that is not going to be covered because your group plan is going to end, you can go on Medicare, but your spouse may not. We have other options. There's out there. And you know what I usually do when I run into that? Rebekah, would you please get me some numbers, because that's not one of I work with all these plans, but I love my Medicare side of it. So I usually look at her because she's up on all of the options out there. So there are options other than just going through what we call the Affordable Care Act, Obamacare, whatever you want to call it. There are other options that she can work with you on. Am I talking too fast? We good? Okay. Original Medicare. So we got 4 parts of Medicare. I think Becca's got this up there, Vanna. We got 4 parts. We got Part A, Part B, Part C, and Part D, okay? You must take, if you are not, like I said, coverage, you've got to have to take your Part B and your D, or you will receive penalties. Part A, okay? The good thing about Part A is most people, just as long as you have worked full-time, 10 years, okay, you are not going to pay for your Part A, 0 cost. So if you didn't work those times, and we're going to go over some numbers, you're going to end up paying for your Part A. 90% of the people that go on to Medicare have earned their Part A. Part B is, and again, it can go up to $565. We're using that as an example, but it's lower than that. It's typically not. Then you got to be really, you got to be really, really down on that. Let's see, Part A, we talked that. Part A also, as far as what it covers, okay? It covers the hospital room. Now, we are talking original Medicare right now, okay? This is original Medicare, what it looks like. This is if you did nothing and do not have any other supplemental or anything to go with your Medicare. Your Part A is basically if you go into a hospital, okay, you're going to pay immediately a $736 deductible. And that's for the first 60 days, okay? If you go into the hospital, go out of the hospital, go back in, you don't have to pay that again. But if you go into the hospital on day 62, guess what? You're going to pay it. So you potentially, on original Medicare, could pay that deductible up to 6 times during the year.
And there's no max out of pocket.
Yes.
So you're not, you're gonna, if you have 6 hospital visits a year, you could be spending hundreds of thousands of dollars.
There's no maximum. So it just keeps going and going and going. Great point. Now, we didn't see this before COVID, okay? But if you were in the hospital and you stayed over that 60 days, then you're going to start paying, okay, a copay. See that copay is $434 for days 61 through 90. We never saw this, but I tell you, during COVID, people stayed in the hospital over that 60 days, and then it continues. So basically, you know, and if you look at the numbers, it's kind of interesting. It's doubled. So if you take that $434 twice, that's how we figured out. Now, these numbers change every year. Okay, so this is not set in stone. This is the 2026 numbers. Part B, okay, your medical side. The premium this year is $202.90. 202, not 203, Brenda. Standard premium. So that can change based on some income. In most cases, it has a one-time deductible of $283, and that's not on the hospital. That is on the medical side, okay? So that's your doctor's visits, your blood work, that is everything. Once you hit the $283, then the plan becomes what they call an 80-20. So Medicare pays 80, you're responsible for 20%. Again, just like Rebekah said, there's no maximum out of pocket though. That is gonna keep going and going and going. Okay, so we talked about this. Based on your income, and these numbers, again, these change every year also. So as you can see, based on your income, your Part B, okay, we have a thing called IRMAA. This lady over here, we had a long talk about IRMAA. And this is important, okay, because of the fact a lot of people get this mixed up because of the fact they aren't taking into account what your income is. If you look at your income thing, okay, if you're 218 or less, you're going to pay that 202.90. And you can see as you go up. So in your head, you know, think about where you may be sitting as far as your income is concerned. The interesting thing about IRMAA is that it can actually creep up on you, okay? Because of the fact IRMAA, and this applies to the Part D, I may be getting a little ahead of myself, it's based on your tax return. And we have a lot of people down in Florida that have 2 homes. And they have their home up north, they have their home down here, and they decide to sell their home. Well, guess what? The capital gains is considered income. So it's really important. And the sad thing about this, once you get put in, so say for instance, you do go up to this 427, it's a 2-year look back. So you've got to stay on top of it. And if you get to the point where you are in that 2 years and you're still paying that, they need to adjust it, and you need to call Social Security and tell them that your income is no longer in that category. I've had people that have just paid it for almost 4 or 5 months and forgot to call and change it. And they've just, yeah, I don't think they ever got their money back. I don't think there's a chance on that one. So again, just keep an eye, and you know where you fall. If you're turning 65, you got to have that number with you when you call to get your Part B, because they're going to ask you that over the phone to find out what category you fall in. Okay.
Yes.
Adjusted gross, yes. Previous, yeah. They're going to want the previous year, but again, the IRMAA can go back to 2 years. Okay. Okay. So we also have some things that we always like people to know about. Okay. The Medicare Savings Program. Okay. And basically, what this is the if there are possible ways to help reduce your costs. And again, these are the income limits. I'm not going to get into this too tight, but if you fall with any of these income limits, it's very important that you talk to someone regarding what they call LIS, because that is a way to help you possibly help pay for your Part B premiums and reduce your prescription drug costs. A lot of people don't realize these programs are out, but they also have a 2-year look back on this. So you might say, oh, you know, I'm only a few dollars after here. Well, maybe I can. I'm okay on the income, but maybe they go back 2 years. So if you try to transfer money or anything, they're not gonna. they're gonna catch up with you. But if you know somebody that could, needs information on this, like I said, it's called LIS, and you also apply for that through Social Security. Okay, the next one. So you got to pay that Part B premium because it's not coming out. Please do not set this up on what we call bill pay. You know how we all got bill pay through our banks? The money gets lost. I've had 5 or 6 people that have gone ahead, they've gone in their bank and they've tried to pay it through bill pay, and it says right on there that they show IRS, they show the money being taken to them. We don't know where the money. I had a client that's still fighting for almost $3,000. So please, if you're going to have to pay that, okay, pay it on the Medicare.gov, get set up on the Easy Pay, or just do a check. A good old check sometimes, or auto pay. Sometimes, that's your greatest way of showing that you've paid that. So it's not been fun, and I don't know what could have happened. Okay, so now we talked about original Medicare. Okay, so how do you protect yourself from not having to deal with all this? Okay, you got 2 choices. You got original Medicare with a supplement, or you got original Medicare Advantage, which is Part C, and we're going to go into a little bit more detail with that. People say to me all the time, what is the best? There is no best, okay? It's got to be what's best for you based on your income, your doctors, your prescriptions. It's like putting a puzzle together. And this is what I tell everyone also, is just because your spouse may be on this plan, you may need to be on something different because of your situation. So, none of it is the best. We used to have before 2010, we had just original Medicare, I think it was, 2010, original Medicare. And what the government decided was people can't afford a supplement. So they have all these people running around on original Medicare only, and because they couldn't afford a supplement to Medicare. That's why they went ahead and they created these plans.
It was earlier than that.
Was it earlier than that? I know the prescription drug was 2010.
I think it was like 2005.
2005? Okay. Time flies,
Advantage plans, yeah.
The Advantage plans, because a lot of people can't afford a supplement, and the government realized that. Because, need to have one, though, because, again, original Medicare, like Rebekah said, there is no maximum out of pocket. So you've got to have protection no matter which one of these, and there's no best. So a supplement, they call them Medigaps, they call them all these different names, but you're going to pay an additional premium. But the way they work is, okay, number one, Medicare gets their bill, okay, Medicare pays their portion, and then they send the balance off to the supplemental company. Now, with a supplement, you're going to have the most freedom, okay? Because with a supplement, you don't have to have referrals. You don't have to have stay within a network of doctors, okay? When I have somebody come in that's got 20 doctors and 20 medications, and they are very complex, okay, then yeah, sometimes a supplement will work better. But you got to remember, you're taking your $202.90, okay, and you're going to put another premium on top of that. So you could end up that, freedom, but you got costs involved.
As long as the doctor takes Medicare, they have to take your supplement.
Absolutely. That's a great point.
If they take Medicare and then they try to say, no, we're not going to take your supplement, then they're wrong.
They
have to take
They will lose their ability to take Medicare. If Medicare finds out, because we have a lot of confusion on that. That was a good point. We have a lot of confusion on that. People will say, well, I called this doctor's office and they won't take this plan. And I say, well, you're on a supplement. Well, they said they don't take that plan. Well, they're getting it confused. The doctor's offices are getting it confused with Medicare Advantage plans.
For example, like United Healthcare has both a supplement and Advantage plans.
Yep.
If you say you're on United Healthcare, most doctor's offices will automatically think it's an Advantage plan, and if they're not taking it, that's why they might say no.
Yeah, and usually I get on the phone with the doctor's office and we have a nice talk. Let's put it that way. We have a nice talk because a lot of times the girls up front don't understand, and that's the problem. They're not educated in the insurance side of it, but we get it figured out. We get it figured out real quick. This is the other thing. We have a lot of snowbirds, and I don't know if anybody is in that situation here, but we have also a lot of people that have their doctors up north. Okay, so they come here and they have part of their doctors are here, part of their doctors are up north. I got a ton of people that do this. So supplement is really their only way to keep all their doctors because they don't have to worry about a network. The other thing is, and this is what I really, really stress, okay, when you're turning 65, this is your one-time shot to get what they call a guarantee issue on a supplement, okay? Guarantee issue means that the supplemental company has to take you no matter what, okay? So you could have all kinds of health issues, and that company has to take you. and they can't deny you. After that 12-month period, okay, after that guarantee issue period, then you have to go through medical underwriting to get a supplement. And I get this a lot. I get a lot of people that go on Medicare Advantage plans. And believe me, I'm not, either one of them are fine. But I end up with the situation where, you know, they're perfectly healthy, then all of a sudden they get the big C, or they have a heart attack, and they need a supplement because they don't like the doctors, and I can't do anything for them. So it's not, you know, it's just something you got to be aware of. That guarantee issue is very important. Now, again, supplements are like buying, I use this example because my mother always loved Pepperidge Farm bread. It's like buying a thing of Pepperidge Farm bread, okay? You can go to Walmart, Publix, Winn-Dixie, no more Winn-Dixie, that's Aldi now. And that bread is gonna cost you a different cost, okay? It doesn't matter, it's the same bread, but they're gonna charge you a different price, okay? Supplements are the same way. Supplements, when you get into a supplement to Medicare, you basically, you have, you know, a plan is, and we're going to talk about this in a minute, a plan is the same with every company, okay? They have to. The government regulates these plans. So one company can't say, oh, I'm not going to cover this, but I'll cover this. They can't do it, okay? So it's, again, people say to me, oh, I've got to have this company, or I got to have this company. No, you don't. You know, we go shopping, we go see, exactly, we go find the plan that's the most affordable and what we feel, and sometimes it may be a couple dollars more than another company, but we've dealt with them and we know what, you know, the good parts as far as the customer service and the other things. So again, don't let anybody tell you there's a company that goes around saying that their plan is the best plan in the county, and that's not the case. We look at the Plan G, okay, and the Plan G basically covers the most comprehensive coverage. Now, we have a couple other plans we look at. I'm not going to get into it, but the Plan G, bottom line, if you pay out that monthly premium, you're going to pay that $283 deductible, and then after that, you'll pay nothing, okay? Unless Medicare declines it. Medicare, no doctor should do something if Medicare is not going to approve it. Shame on them if that's the case. So again, the G, in our point, as far as what we're concerned, that's the most comprehensive. But if that one is not an option, we have a couple others, one other that we look at. Okay. We will ask you always for your prescription drugs because when you're on a Medicare Advantage plan, it includes your drugs, okay? When you're on a supplement, though, we have to do what we call a standalone drug plan. And in this area, there's about 35 different plans. So we have a wonderful tool that we can take all of your medications, we can punch it in, and then we can find out exactly what's the appropriate plan. And everybody has access to this. It's Medicare.gov, not just us. We're not special. It's just everybody can get into it and see what those things. So it's Medicare.gov if anybody wants to look at that. And it's really simple because you go in and you punch in your drugs, and then it's important, though, that, you know, some companies won't cover some. And a lot of people just think, oh, just because this is a generic, everybody's going to cover it. No, each of the companies are a little different. On those plans, you can have a premium of $0, or you can have a premium of $30, okay? But again, on the supplement, you got your Part B, you got your supplement cost, and then you got your drugs. So you got all three of those that you got to consider in your financial picture. Annual review, it's important, okay? You must need to do an annual review, okay? Whether it's go online with Medicare.gov, but take a look at it because these plans change drastically. And some carriers have deductibles, some don't. But there's other thing we look at is your pharmacist, okay, your pharmacy. You can have a preferred pharmacy, standard, out of network. Get rid of the standard, get rid of the out of the network. Always look for your preferred pharmacy because the cost can be tremendous difference, okay? I can't tell you how many people I have run into that haven't had their drugs looked at for probably 2 or 3 years, and then they're paying out hundreds and hundreds and hundreds of dollars. Good thing is that Medicare now has a cap. Once you hit $2,000 out of pocket, you pay nothing for your drugs. We got rid of, I don't know if some of you remember the old donut hole and all those different levels. They got rid of it all, okay? Now it's $2,000. They have made it so much simpler. So that makes it a lot easier for us because that way once you hit, I have clients that hit $2,000 in the first 3 months. So, yeah, especially my insulin clients. And some of my high risk people, chronic conditions, they've hit that sometimes at $2,000 by the time they hit the month of March. So, okay, so we're going to go into the I can't say that
Some
word.
examples.
Some examples, hypothotic, whatever that word is. And it's just showing you the difference between, we took some of the drugs, now this is the same, right? Okay. We took basically the difference between having a preferred pharmacy versus a not out-of-network pharmacy. Look at the difference in cost, guys, okay? Again, amlodipine and lisinopril, those are pretty much generic drugs, okay? Those are very metformin, okay? Sometimes you can go, and I can tell you right now, in our area, metformin is probably zero in most of the preferred pharmacies. But it's interesting, if you don't use that, look at the difference in money. I mean, it's a lot. Let me see, there was something else. Always, when you are talking to somebody about this, make sure you tell them what drugstore you're currently going to. I have a lot of people that think that they're going to Publix, but the preferred pharmacy, CVS, they can't switch them. You can switch them. They can be transferred. Sometimes it's a little paperwork, but they can transfer those over. The next one is the standard in-network. So see, you got the three choices, but you're still less than the out-of-network, but you're still not as good as it would be for preferred. So, okay, Part D. We're going to talk about Part D next. That's a lot like we talked about on the IRMAA. Okay, the same type of thing where you're going to basically get penalized if you are over the income. And you can see the income limits are pretty much the same, okay? 2 years look back like we talked about. Shoot high when you look at these numbers, okay? Because if you underestimate, then you're gonna end up paying for it at the end. But as you can see, it's gonna be a penalty, that penalty is going to follow you for life. So it's not going to be just for the first year. It's not going to be it's going to go. So you're going to have basically, and what it comes out to, there's a percentage, but this is the easiest way I can do it. It comes out to like $4 for every year that you don't take a plan. But let's say you take a plan, you haven't taken a plan for, let's just use 5 years, okay? So that's $20. You're going to pay $20 penalty every month for the rest of your life. My in-laws were in their 80s. They were on original Medicare, and they had a supplement. They thought their supplement covered their drugs. It used to be way back in the day they did. Well, they both got sick, and they ended up with $85 a month penalties each. So we find people out there, and usually they're in their 80s, that did not know that their supplements no longer cover drugs. So if you know anybody that's in that age group, you might want to see, hey, have you thought about this? Because they probably have no clue. They probably have no clue. The Part D enrollment, again, the Part D enrollment, we just talked about that. It averages about $4 a month for every month you don't have it. So, and I made a mistake. I apologize, guys. As you can see, the slide before, I'm ahead of myself, those are the actual penalties plus the plan premium. So if you got a penalty, the $37.50, you're going to also have possibly a premium for that plan. And remember, we have plans that have a $0 premium. We have plans that could be a $30 premium. Okay, we talked about the enrollment fee. Pretty much the carriers in this area the main ones are Humana, United Healthcare, WellCare, and Aetna SilverScript, okay? Rebekah, I always call her Rebekah. Rebekah and I both, we are what we call independent brokers, okay? So we work with all the companies. So it doesn't matter, we put you in, we always try to put our clients in with the best, which any agent should do, okay? Put you in, not look at the name of the company, just put you in the company that's going to give you the least costly. Yes, never assume. Now, people that don't understand too, if you're on Medicare and you have a Part D, okay? A lot of times those drugs are still very expensive, okay? They're in high tiers. There are other options. And Publix is a really good one about this. Publix always looks to see if you may be able to do better with one of these companies. GoodRx does a good job. Sometimes, it's the biggest one. And you don't have to use your drug plan. The government says you got to have a drug plan, but you don't have to use it. So a lot of times I have clients that just don't even go through Medicare, and they're getting their drugs other ways. So don't feel like you've got to go with that particular plan.
For example, like Wegovy and what's the other one? The weight loss and
all the
sugar regulations.
Yeah.
Those are not, well, now they're going to be covered, but mostly they're not covered by Medicare, so they're not going to be covered for the most part, under a Part D plan. So GoodRx is probably going to be the best option if your Part D plan doesn't cover it.
Yeah, and those drugs even change. I mean, technically you should be. Technically, most of these drugs, especially if they're generic, I don't know if you guys remember Crestor. Crestor came in to be like the miracle cholesterol drug back 10 years ago now probably. And it was so expensive, but people were paying out $100 a month for Crestor. Crestor, after a certain time period, the government has to look at a generic. And normally, we see it to be right around 5 years. So some of these drugs are going to start probably getting more affordable. If you see the drug on TV, anything that's on television, it's going to be very expensive, okay? And all those drugs, they show you Skyrizi, all of those, they may be very good drugs, but they're going to cost you a lot of money.
Yeah, they have patents.
Exactly. Exactly, they are. And, and what irks me the most is when a doctor puts somebody on those drugs, knowing that that's a $2,000 a month expense. People can't afford it. Most people can't afford that.
Well, it used to be you couldn't use the GoodRx, you couldn't use coupons.
Yeah, it's getting better. And again, the Publix pharmacy or CVS pharmacy, wherever you go, they should be able to give you costs on this stuff.
Yeah.
Okay, so let's do the math. So if we're looking at a supplement to Medicare, you're seeing the next is really a great way to look at this. That 220, I would say close. It goes. Yeah, it's based on your age because you're always going to be the less costly going in at 65. If you go in anything past 65, it's going to be more costly. That number is really probably a little conservative right now. We're seeing. I pulled some yesterday, and I'm seeing a little bit of a jump, not by much, but just that these are not carved in stone. That's the average. The next one is Medicare Advantage versus Original Medicare. So let's talk about Medicare Advantage real quick. These are run by private insurance companies, and basically they're under contract with Medicare. You have to have your Part A and your Part B to go on a Medicare Advantage plan. Cost for services and copays, basically they all have a maximum out of pocket, which like Rebekah said, Original Medicare, you keep going and going and going. These you don't, okay? So basically you have there's a maximum, and all of them have a maximum that show the worst case scenario. If I was to get sick, what am I gonna have to put out? They may offer extra benefits, okay? Dental, vision, hearing. Silver Seekers is the gym membership. I don't find too many people use it, but it's sad. And then again, you're still going to pay the Part B. It's open enrollment. So that time of year between October 15th and December 7th, we have our roller skates on because these plans change, guys. Last year we saw significant changes. We're happy about them. And I can tell you if you're on a Medicare Advantage plan, you need to really stay tuned and you need to really talk to someone about if the plan's appropriate for you. Also, doctors can come in and out of these plans, okay? So you can start out with a doctor in January that takes your plan and then they can decide to get out. We're having some doctors right now get out of some plans and they have to give Medicare 60-day notice, but they can just drop. And that's probably one of the biggest aggravations I've had over the years. You go onto a plan in a good heart saying, I like this plan, my doctors take it, and you can go 6 months down the road and that plan, the doctor doesn't take it. You walk into the doctor's office.
And the worst thing is you can't switch unless you qualify for a chronic.
Yep. And we're dealing with one right now, and it's not been fun. And we find out we have a lot of healthy clients because they can't switch. So they're stuck unless you got a chronic plan, which means you have an illness that there's some special plans we can get you into. Please don't pick a plan for all the extras, okay? I get this call all the time. I got 3 calls yesterday on this. What these plan 1 and 2, the first one's an HMO. Now, these numbers are a little different for Charlotte County. The folks that created this slide for us, I think they're using some, possibly, I think this is probably Tampa, but because the numbers, in our area, PPO on this side, HMO. In our area, there's no PPO with a primary care provider of $5, okay? They're all 0. But everything else is pretty much the same. This right here, and this right here, I call this stuff, this is all little incentive stuff. And I tell everybody, please do not pick a plan for the dental. Please do not pick a plan for an over-the-counter benefit. Pick a plan for your medical and your hospital side of it. Now, what happens when you go on these Medicare Advantage plans, okay? You are no longer on Original Medicare. Like with a supplement, your bill goes to Medicare, then Medicare sends the balance to the supplemental company, okay? When you're on one of these Medicare Advantage plans, the company is under contract with Medicare, so now Original Medicare is not having to deal with you. They're saving money. This is a money saver for Medicare. So what Medicare does is they nicely pay these insurance companies every month, averages somewhere between $800 and $900 to take care of you. So obviously, for the Medicare Advantage company, it's quite profitable, because if you've got healthy people that only go to the doctor once or twice a year, they're making a ton of money. So what they do is they give back all these little extra things. Okay, I call it fluff, because you take a plan for the medical side of it and your doctors and your prescriptions. If you get those little extra things thrown in, it's wonderful. But don't make that decision based on that. Let's see. When you're on a Medicare Advantage plan, your biggest kicker, okay, is going to be if you end up in the hospital. Most of the time on Medicare Advantage plans, you're going to pay $0 for your primary, annual visit's going to be $0, blood work's going to be $0, all your preventative stuff. But if you go into the hospital, that's where your kicker is, and that's when I usually get the phone call. Because most average, and I'm using an average right now for this area, you're probably looking around $300 a night, and you have to pay for so many nights. So most of the companies are 5, 6, or 7. But you're going to pay $500. So say you go in the hospital, okay, for 4 nights. Let's just use 500, use some easy numbers. That's $2,000. So that's when I get the phone call, and people are saying, I can't afford this, I can't pay for this. So we do have something, and not just us, these plans are available all over, called hospital indemnity plans. And we strongly suggest, because with these Medicare Advantage plans, I skipped this, okay? There is $0 premium, okay? So what we say is supplement is like your car insurance. You're going to pay your car insurance every month, whether you use it or you don't use it. Medicare Advantage plan, we pay as you go. So you're not going to pay a monthly premium, but you're going to pay when you use it. So the biggest kickers are going to be your overnight hospital stays. Ambulance rides are very expensive. Unfortunately, cancer and ER visits are going to be. So there are plans, and they're very, very small premiums, average maybe $50 a month. So that's an option for people. What we always say, if you don't do the supplemental, you go Medicare Advantage, hey, you're still going to save some money. You're not paying out that premium, and you're going to give yourself a little extra protection on that. Okay, enrollment periods. This is always a very kind of a confusing time for people. So open enrollment, okay, that's January 1st through March 31st. That is when you are on a Medicare Advantage plan. You did not make a change during AEP. We call that the October 15th through December 7th. My words right here. You can move over to an MA to an MA. And you got that. They just started this about 5 years ago, because they recognized, the government recognized, you got everybody in this country that are on these plans. Nobody can get, there's just too many people to try to service. And the insurance companies even can't deal with it. There's just too much. So you can also, during that time, from January 1st to March 31st, go from a MA to a supplement. But I'm going to put the button here, okay? If you've got health concerns, you've got to do that early. You've got to do that like in January, because of the fact you're going to be medically underwritten. You're not guarantee issue because you've passed that 65 window. So I always say, and sometimes I get people that want to make a change and they were really close to even, I will not move somebody to a supplement. I will have them wait to January if I'm like in November even, because sometimes these supplement companies can take a long time to make a decision. And the last thing you want to do is to be without coverage. So your annual review, again, things to consider, your change in your doctors, your health, basically those things are constantly. And sometimes when you are having some health issues, there's other things we can do, okay? We have other plans. We have the dual eligible plans, okay? Now these are for folks that are both on Medicare and Medicaid. And we will help you through that process. A lot of people don't realize they qualify for Medicaid. And there are some plans out there, most of them are HMOs, okay, which we talked about. HMOs are a little bit more conservative. The networks are smaller versus a PPO, but they also offer a lot of extra things. They have health care people calling them, checking on them. There's just a lot of extra perks. But again, those income limits are pretty tight. So if you think you know somebody that may need that assistance, we can help guide them to how to find those numbers and where those numbers are.
We can also check if they're
Yeah.
already on Medicaid. So we have a system,
Perfect.
we can put in their Medicare number and it'll show up if they have Medicaid or not. Because a lot of people, actually I had a client, she was qualified for Medicaid, they never sent her a letter in the mail.
Yeah.
So if I didn't have checked, we would never have switched her to a dual plan.
And actually, Rebekah works a lot with those dual plans. She works a lot with the chronics and the duals. One thing I don't, I'm like, oh, you can do that, Rebekah. Who can join a Medicare Advantage plan? No health questions. Anybody can join a Medicare Advantage plan. Okay, just as long as you have your Part A and your Part B, okay, you're good. And again, there's $0 premium. So this is where each plan is different too. Let me also bring that up. Every Medicare Advantage plan in this county is different. So there's one plan may have a copay of $50 for a specialist. One plan may have a copay for $35 for a specialist. Again, that's where you got to really dig and find out where your doctors are. If I have somebody that comes into me and they've got 10 specialists and they see them every other month, I do the math. You add up what the copays are going to be and say, well, this is your options here.
Also, if a doctor says they take a plan, like let's
yes.
say Humana, and you go on the that doesn't mean they take all the Humana plans.
That's a great
idea. They
idea.
could just take the chronics, or they can just take the HMOs, or they can just take the PPOs.
Yep.
So every single company has probably about 100 different plans in the area.
Yep.
So just because they say they take Humana doesn't mean they take your plan.
And those plans change from county to county, okay? So you may live in Charlotte County, but some of you may be up in Northport for New York. Those plans are going to be different. They're going to be different for Northport in some cases and some different in Charlotte County. So it's all based on your geographical location. So and if you move, okay, that's the other part about it. If you ever do move, okay, you have a time window when you change your address with Social Security because you have to change that Medicare Advantage plan. Supplement, no. Supplements go with you. They pack in the suitcase. They go with you. They just follow you. But with the Medicare Advantage plans and the standalone Part D, okay, you must live in that area. If they find out that you're not, then they will cancel you. So, what if you're on Medicare as far as the copays and deductibles? I think we already covered most of that already. Medicaid, excuse me. We talked about that as far as, and usually on Medicaid plans too, your premiums, your deductibles, the copays, most of them are zero, okay? But they monitor that really close. Let's see, VA, okay? If you've got veterans benefits, we have an expert in the office, the owner, Brian. He is an expert on VA, okay? VA is right next door to the office up there. But if you have questions on that, you get your benefits. People that, and the first thing I learned when I got into this business was if I ever came across anybody that's got TRICARE, you don't ever move those people because that is the best coverage you can have when you're a VA on TRICARE. But if you have other just partial coverages with VA, I'm not to say I'm going to be a VA expert here, but we have Brian, or the VA people next door to us. They have some great people over there that can help guide you. We have a lot of clients that are on VA, and they use the VA for health care and prescriptions, but they also get a Medicare Advantage plan for just to be able to go to a local doctor because they don't want to have to travel, okay? So there's nothing wrong with having it. It's just sometimes, that's just a preference. They have it just kind of as a backup, okay? Again, Medicare Supplement versus Medicare Advantage. This is a great film. Basically, you have no copays, higher premiums, but no copays or coinsurance. We talked about that. No referrals, okay? Companies are getting better on the referrals, okay? It used to be, people would say, oh my gosh, I got to go get a referral. It's all done electronically now. So I don't see referrals to be a big deal. And if you get sick, you're going to go to your primary doctor for the first time. You don't feel well, you're going to go to your primary. Primary is going to say you need to see a specialist. They hit that referral button and send you out. So I don't see that to be a big deal. And again, Medicare, original Medicare and a supplement only worries about your neck down. So they do not cover some of the fluff stuff like I talked about before, the dental and the vision and that, okay? But if you have an eye infection, it's going to get covered, okay? If you have an earache, it's going to get covered, but they're not going to do routine tests. They're not going to do routine preventative stuff like that, which some of the Medicare Advantages companies do offer some of that, like I call fluff.
I also can do standalone dental and vision plans.
Yeah, we have lots of those.
So if you have a supplement and you need vision insurance, you can get a plan. So.
Okay, so transitioning from Medicare Advantage to a Medicare supplement, okay? When you're turning 65, you have 12 months. So when you sign that paperwork for a Medicare Advantage plan and you say, yeah, I should have gone with that Medicare supplement, we have a 12-month window we can switch you, okay? A lot of people don't realize that. You're not set in it. If you remain on the Medicare Advantage plan, though, more than 12 months, then you're going to have to wait for either the AEP during the year or the OEP at the beginning of the year, okay? Transitioning from Medicare Supplement to Medicare Advantage, again, that can be done between October 15th and December 7th. All the plans start on the 1st, okay, when we're talking about that annual enrollment period. Everything starts January 1st. How are we doing? We're doing good here? Okay, perfect. Let me see.
Skip that.
Yep. again, I just want to go over, basically, we are all independent agents. We are located locally owned. We represent multiple carriers, so we have nobody in our back pocket. We work with them all. Basically, you know, we do like to talk to our clients every year, and we're more than happy to talk over the phone or in person. So we're local, and
Our office is in the mall, actually,
Yeah.
across from DSW.
it's very
Dillard's.
very scary because it's near Dillard's. I'm just telling all of you people that I love Dillard's, and I usually go out of the office and say, no, you gotta go home. So bottom line, you know, the office is in a great location, so if you need help, it's handicap accessible, very easy. You know where DSW shoes is? Okay, if you go in DSW, turn right to the right, there we are, so.
Look for the DAV right there.
Yeah, look for the Department of the, and I'm personally not there, Becca's there more than I am during the weekdays, but I did it within time period.
And